Hello everyone, my name is Dr. Sanket Pisat, and today we are going to be talking about some of the most frequently asked questions about one of the most commonest surgeries performed in gynecological practice, which is hysterectomy or uterus removal surgery. So, most of the times there are a specific set of questions that the patients want to always know, and these are the questions that we are going to be covering in today's video. More important among the questions that patients ask us are firstly, do I actually need a hysterectomy? Or why is it that patients do need to undergo a hysterectomy? Am I a candidate for a hysterectomy or do I not need a hysterectomy? So, firstly, we are going to be looking at the indications for doing a hysterectomy and alternatives to not performing a hysterectomy for those particular conditions. Secondly, we are going to be looking at the second most common question, which is the best route for a hysterectomy. Is it a laparoscopic hysterectomy, a vaginal hysterectomy, or an open abdominal hysterectomy? Thirdly, we are going to be looking at what is the specific quality of life after a hysterectomy. Does it remarkably change after uterus removal? And are there any long term risks and consequences associated with a uterus removal surgery? So, these are the three or four points that we are going to be discussing in today's video. And so, let's get started. First off, what exactly are the indications for a hysterectomy, or when would you consider having a uterus removed? Now, it is important to note that if you have actually considered the undergoing a hysterectomy, then there is something, some of your symptoms at least, which are bothering you and are affecting your quality of life significantly. For most of these patients, the symptoms are either most commonly heavy menstrual bleeding, or it could be a lot of pelvic pain, or it could be a prolapse, which means that the uterus is slowly coming out through the vagina, coming out through the body, and getting itself into the vagina, or probably coming outside the vagina and protruding outside the patient's body. Or fourthly, you could have been diagnosed with a cancer of the uterus or a precancer of the uterus or any of its surrounding organs, which necessitates the removal of the uterus. So, first, it is important to understand which of these causes it is in your case. Let us take each cause one by one. The first and most important cause is heavy menstrual bleeding. Now, heavy menstrual bleeding can occur due to a variety of reasons. Most commonly, this is due to fibroids. If it is indeed due to fibroids, the surgical removal option of removing only the fibroids without removing the uterus always exists as a uterus saving surgery. As you know, we try to do hysterectomy as a last resort procedure when all the other methods of medical management have failed, when all the other methods of different types of surgeries have failed, that is the time when we resort to a uterus removal surgery. So, first off, if it is a fibroid which is causing the heavy menstrual bleeding, you need to discuss with your doctor whether removal of the fibroid only is possible as compared to removing the uterus entirely, particularly those fibroids which are large submucous fibroids or fibroid polyps. We do have another video on the various types of fibroids. I'm going to put up a link in the description box below. But if you have any of these submucous fibroids or fibroid polyps, these can be removed very easily by hysteroscopy alone and definitely do not require a uterus removal surgery. Yes, of course, for those fibroids which are large, extensive, and almost replacing or occupying the entire uterus, a hysterectomy or a uterus removal surgery may be justified. The second important reason for having heavy menstrual bleeding is adenomyosis. Adenomyosis is also a growth of the uterine wall itself, but unlike a fibroid, this is very much mingled or part of the uterine wall and can be very difficult to remove surgically. Even if removed surgically, it has got a good chance of growing back. And hence, patients with extensive adenomyosis may consider having the uterus removed if their childbearing or their fertility is complete. The other important cause for a heavy menstrual bleeding would be something as simple as a thickened endometrium, but this will show up on the sonography, and this definitely can be managed by hysteroscopy alone and does not require hysterectomy to treat this particular condition. Another important cause of heavy menstrual bleeding could be sometimes we put it as unexplained. So, in spite of all your best efforts to diagnose what is the cause of the heavy menstrual bleeding, the cause still remains unexplained. And these are the patients who may be subjected for a uterus removal surgery. Also, again, in these patients, sometimes a surgery called uterus endometrial ablation surgery or TCRE, also known as transcervical resection of the endometrium, is an alternative to hysterectomy where we perform under hysteroscopic guidance removal of the lining of the inside of the uterus. And once the lining has been removed completely, there is nothing left behind inside the uterus to bleed month after month. So the intensity of periods reduces significantly to almost zero and therefore does not trouble the patient. The advantage is that it is a much less invasive surgery as compared to a hysterectomy. And since it is only a hysteroscopic surgery, the patient can get discharged on the same day as well. So that is the catch on heavy menstrual bleeding. The second reason why you may be choosing to undergo a hysterectomy is pelvic pain. A lot of times, chronic pelvic pain or severe pelvic pain is due to a condition called endometriosis. Now, for the most part, endometriosis is a surgical disease and has to be managed surgically. These are implants of menstrual blood which have not found their way outside the body and have got implanted at various different organs like the ovaries, sometimes over the intestines. And these need to be removed surgically in order for medicines to take best effect. For those patients who may not be willing for such an extensive surgery, or in whom you're waiting for a surgery for some other reasons, like maybe financial factors, there are a variety of medicines available to keep the disease at bay for a period of months or even sometimes a year or so. But it must be understood that these medicines have got limited potential, and either these medicines must be combined with an IVF treatment cycle in order to get the patient pregnant, after which the endometriosis intensity reduces significantly, or if not, at one date or another, surgery does need to be planned. And in these cases, you may need to undergo removal of the uterus. Uh, the next patients in whom a uterus removal surgery may be considered are the patients with prolapse. Now, in patients with prolapse, the uterus has descended outside the body and into the vagina. In these patients, whether or not to remove the uterus depends largely on the patient's desire to conserve the uterus both for menstrual as well as for childbearing and sexual function. There are two types of treatment options available. One, of course, is the hysterectomy to remove the uterus, and second is a type of surgery to suspend the uterus to another bony structure inside the patient's abdomen, which is called as a sling surgery. So, sling surgeries can also be performed in order to pull up the uterus rather than removing the uterus completely if the patient so desires. The fourth cause for doing a uterus removal surgery is cancer of the uterus. And in cases of cancer of the uterus, it is mandatory that the uterus has to be removed. There is really no conservative treatment or management option which is possible.